Hey, Lawrence here. WeCareHealthCareInitiative.com. That's WeCareHealthCareInitiative.com. Okay, I'm just going to go real quick. Um, if you go to the home page, uh, you can make donations and stuff. What this is going to be a new healthcare token. We're going to do this way. In the long run, hopefully to replace insurance. This will be decentralized, owned by the people, for the people, paying for all your healthcare needs. I've talked to many doctors, and there's a lot that actually want to get on the system, but this has been taking years for me to make. I'm getting closer to the back end. That's why I'm making these videos now. Hopefully, I will start having things rolling out in the near future. It's just a lot of work. So, but anyway, there's a meme coin, scaredy cat token. This is the meme coin. This is the address here that you have to actually copy and paste into the Solana to buy this meme coin, because it just comes up as like a VJP, some kind of thing. It doesn't say scaredy cat token. So basically, you have to search for the token on Solana because there's not a lot of liquidity in there at the moment. I think there was only like 1,500 or a couple thousand in there. So basically, it doesn't show the whole name and the meme and stuff. There's not enough money in it. But anyway, eventually, these will be worth some money, and you won't have to worry about doing all that. But as it goes for now anyway, this will be the token that you'll buy the healthcare token with. Okay, so this one you can buy, trade, and keep, sell, whatever you want to do with it. But in order to buy the healthcare token, you have to buy this token. And all transactions, a percentage of the transactions from buying and selling and trading, whether you're buying the healthcare token or not, basically a percentage of that goes towards the healthcare fund. Okay, so basically, if you're just buying and selling, you're still contributing to the healthcare fund. Okay, because a percentage of these buys and sells of that transaction goes to it. But you have to buy this in order to buy the healthcare token. We don't have the healthcare token that's available at this moment. This is the only one that's available. I'm in the process of building trading bots, which I'm almost done. I've been working on it for like a year and a half now, and pretty much almost got the back end pretty much done. So the trading bots will actually also feed into this and into the healthcare pot. So, this will increase, it will help increase the liquidity and the token price. So the more that you buy and sell, the price goes up. The more that the bot contributes to the liquidity also will help the price and help your price. So anyway, get in early while you can, because in time these tokens will be pretty hefty price. But anyway, get them now, and then also hold on to them for the healthcare token, because you'll need to use them to buy the healthcare tokens. Okay, and what it is basically, it'll be like a cash system for healthcare. We will do all the research. We will have our own buildings. We'll do everything. Eventually down the road, our own hospitals and all that stuff. But it's owned by the people. It's almost like profit sharing, you could say. It's like a profit share healthcare token. It's decentralized. Nobody controls it. It'll have a committee, like people from the outside there'll be like so much percentage of tokens in order, say like, you have to have at least 1% of tokens or something like that in order to have a say. And then basically anybody with 1%, everybody has an equal say, whether you have 1% or 100%, so, it's kind of like, it doesn't put people with less money at disadvantage on having anything to say of how they'd like health care or what they might want done, or what might help advance it and stuff. This is going to be owned by the people, for the people, run by the people. Okay. And these tokens eventually, some will have, because basically we have some tokens that will go to help pay basically we would consider these as currently as $1. So if we have somebody that's helping us to build this, they might get, say if it cost us $30,000, they might get 30,000 coins, for helping with building the platform or something. You know what I mean? So basically, until it gets going, if it goes over $1, well then it will go by that. But until it hits $1 per token, we'll consider these $1, and that's how we'll pay out for the help. So if you want to volunteer, or if you want to become somebody who wants to help out in the project to kind of help get real health care for people, always looking for anybody who's willing to kind of come along in this journey. This is a long journey. I've been working on this for years, but it's kind of like getting to a point where I'm really going to start needing some help so I can get moving it along. Donate. There's different ways to donate. It tells you all about. Now this isn't really up to date, because I did this a couple of years ago. I've been learning coding and all this other stuff over the past couple of years, so this is how I started though. First I started with building the token, first I started building the this website, and then after I built the website, then I built the token, and then I've been learning to code to kind of help build out the rest of the stuff. So now, that I got this, we can go ahead, I'm just moving along forward. So just giving you a short little thing. So basically, really what this is like, will be healthcare. You'll be able to use it globally. It'll be like a cash system. So basically, it'll be between you and the doctor, and you'll, whatever you ask him to do, and he thinks that would be good for your health, then that's what you will do. It won't be what the insurance says that they can do, or what they can't do, what the government says that you can't do. I've been in healthcare 27 years, and I get tired of hearing them saying we can't do this, we can't do that, insurance doesn't cover this, but it would be for your benefit, but no, it's not covered. Or, it would be for your benefit, but no, it takes out of the hospital's pool of money, so we can't, do that. This is just as acceptable. And it's like, no, it's not just as acceptable. And so basically this here will kind of get that going, and it will give insurances some competition. And basically this is a cash system. You will have your own currency in your own wallet, and nobody can tell you what you can use it for, as long as it's used for healthcare. Like I said, the meme token, though, doesn't have to be. That's how you buy the healthcare token. But the healthcare token itself can only be used for healthcare. Like I said, we're not there yet. So right now we're just doing this meme coin, this will be the foundation of getting the finances started for the pool. So each percentage, small percentage of these tokens actually will be going into the pool. So even before the healthcare token's done, anybody trading these, actually there's money that's already would be going into the pool where the tokens aren't even made yet. So they will start with some liquidity when they do get started, which is a good thing. So because then that will also help increase the value. So as soon as you start buying the healthcare tokens, say you buy $1 worth of healthcare tokens, it might already be worth $1.25 because of the liquidity that was already in there from trading by the time we get it started. Okay, so then so you might actually have like $1.25 when you buy in the beginning for the healthcare token. So you would go to here, and basically you would have to search the token. So you would say buy in, and let me see if I can copy this. No. Okay, so basically you would go there and you would put in at right here where the token search is. Like I said, Scaredy Cat doesn't come up, but let me see. Oops. Scaredy. Cat. Yeah, it doesn't come up. There's other Scaredy Cats. Like I said, basically mine has been there for a while, but these got caution signs. Yeah, so anyway, you have to put that number in here, not Scaredy Cat. You'd have to copy and paste that number in there, and it would pop up with the right Scaredy Cat. Okay, so this here, the C7, this whole token here, put that address in that spot, and then you could buy that. Like I said, that's the healthcare token. So that's pretty much it, really. I just wanted to get on here and get started with some recordings and start getting the word out because I'm getting farther down the line, and really just want to kind of put some videos up and get started in the process. It takes a while. I had another YouTube channel with like 500 videos. It took a long time, years to make. So basically really just kind of getting on here, getting some videos out. But always up for donations, help people. There's donations right now are going towards help build the site up, but eventually we will help others along the way, and this is going to be a good future of healthcare, and it will go it'll be something much better than we have now in today's system. All right, thanks. WeCareHealthcareInitiative.com. Go there, check it out. You can always donate. Just help out. Eventually down the road, it will help pay for your health care and be decentralized. Right now, like for instance, my job has paid probably $20,000 a year into health insurance for 25 years. That's a lot of money. If I quit tomorrow, all that money's gone. Well, if I had that in here and I quit tomorrow, I would still have all that in here because it's in healthcare currency, which is in my wallet, which helps pay for my stuff. Now, over time, if I had 25 years of $20,000 a year built up in here, your company could probably even, after you hit, because these max out at 3 million, and then because they're constantly earning money, and then the overflow actually goes into helping others, and it will help, so for instance, when you start off, you don't have 3 million in there. So basically everybody, the whole system's money, the overabundance goes over to help people with less in there build up faster, because if you only have a little money, it doesn't help you with any health care. So you have to try to get it built up as soon as possible, and this is a people system, so basically this is going to help build up everybody's. And there's going to even be a trading bot, like I said, that goes in there. We'll be getting, eventually it'll be financing buildings, doctors' offices, all that kind of stuff. We'll be renting spaces, and all that will go back into the healthcare system to help keep your insurance money growing. So that will be like a, like I said, it'll be like profit sharing. So basically everything is owned by the system. Everything, all the buildings will be rented out, will be paid for by the system. We'll be doing research and development. See, because this research doesn't make money like big pharma and stuff. So it actually, we'll be looking at stuff that doesn't cost a lot of money to help get you better. Okay? I mean, there's so much stuff like, for instance, the blushwood berry. Okay, there's a lot of research out that it kills like 3 types of cancer, including breast cancer. So it's kind of like, and this is pennies on the dollar, but you won't see it here. You can't even get the berries shipped over here because they won't allow it. But the thing is when we have a healthcare system of our own, owned by us, run by us, we also will be able to do this. We will be able to help us for pennies on the dollar, because we're not doing it for money, we're doing it for better health. Okay? So right here, for instance, okay, these cancer tumors destroyed by the berry, they're found in Queensland, Australia, in the rainforest. Up to 70% of the cases. And it kills it within 48 hours. 48 hours. So, you won't need all that chemo, radiation, all that kind of stuff. It's just injected directly into it. Kills it in 48 hours. Very good research. But the problem is, and this has been known, this article's like 10 years old. This has been known since 2014. But you will not know, because money talks. Well, when we have our own health insurance, our own health care, we will be able to do this for our people in the system. Then you have the Avenger, the Oscillate. This here cleans vessels. Okay? State of the art. It's even FDA approved. Okay? These here catheters clear out 100%. Could be 100% occluded. And this thing just drills right through them. Goes right through them, sucks it right up. Cleans out the vessels. 100%. Could be 100% clogged, and it will just clean it right out. Has no issues with nicks or anything in the vessels, no bleeding, no much less than what nowadays catheters are using. But you can even say, for instance, these things, you would be able to say, instead of doing an open heart, be able to get a catheter like this to be able to clean your vessels out. $3,500 procedure. It's like, okay, yeah, I don't have to get my chest broken open? Okay. Well, for cash, you could pay for that $3,500. Okay, right now with insurances and $150,000, you can't afford the open heart. But you don't have to do open heart. You can just clean the vessels. So there will be things that will be affordable in cash in our health system. This thing has been out for a while. I had invested in it, and it kind of got shelved. So the thing is we want to make sure for our healthcare system, our cash system, everything's going to be affordable so that you can use cash. Okay? The way the healthcare system is now, everything is so much through the roof, and they're making thousands of percent profit that we can't afford anything. It's not that everything costs money, it's just that they're robbing us. So when it's a cash system, you're no longer going to be robbed because you own this system. Like, for instance, these catheters we might have in our own buildings, and then we'll rent them out. We'll rent the docs the space that they can come and use our equipment to do the work on us. And then if they want, we could even rent it out for them to do it for insurance companies too. And we can bill them for the rental, but all that will go towards your health care, and the profits and stuff from that will go into your healthcare and into the healthcare system. And it will be decentralized and owned by everybody. So help me, help you, help me, help others. Okay? Start getting these coins, because eventually, when it does go, and I do get the trading back going and everything else, these things will be worth some money. And then definitely you'll have to buy this in order to buy a healthcare token. So then it will be worth some money. Okay? So kind of, help me get it started, because if these are worth some money, we can kind of tend to cash some out to kind of get the process rolling a little better, to help move this healthcare system along. All right, thanks. Contact me anytime. Anybody wants to help move things along, whether it's volunteer or anything. It's not like I've been doing it for a year and a half. I don't get paid for this. I don't have any money for it. But it's kind of like I said, I'll be probably paying with those healthcare tokens and stuff like that, with the meme coins and stuff. But that's where we're at for now, until the trading bot gets working and it starts building up some money here. But you can always contact me. This I'll update, but our services will be accessible in 195 countries. And being a healthcare currency, as you know, digital currency, it could be, you can be over in Europe, need the hospital, you can use this. It's available anywhere around the world, because this can get exchanged into any currency. So it's a currency that the healthcare currency, it can be exchanged into any currency around the globe. And so whatever, it's a cash system. So whatever that cash turns out to in that country, how much ever they charge you, that's how much you would use out of your healthcare system, out of your healthcare wallet. Okay, so you don't have to be a U.S. citizen to get into the healthcare currency, because this is actually going to be global. It's based on the dollar, but it's not dollars. So it's kind of a cryptocurrency that can be changed to the Chinese yen. It could be changed to the euro or anything, So so it doesn't matter what country you're in. Basically, it's all the same, and that's how it is. All right, thank you. WeCareHealthcareInitiative.com. Greatly appreciate any donations or anything. Contact me if you have any questions.